All right, everyone, we'll go ahead and get started and people can continue to just join as we go. So good afternoon, everyone. I am Kristen Spaduzzi. I'm the Director of Health System Advocacy for the North Carolina Medical Society. And thank you for joining us today for our 2023 kickoff webinar, Legislation, Expectations, and Advocacy. Oh my. These webinars are brought to you in partnership by the North Carolina Medical Society and the North Carolina Medical Group Managers Association. And before we get started, a couple of housekeeping items before I introduce our presenters. If you can keep your mics muted throughout the presentation, enter your questions into the chat and we will do the Q&A portion towards the end of the second half of the hour. And I will keep track of those so that we can go back to them at the end. And a recording of today's webinar will be made available in a couple of days. And so I'll make sure that both organizations have that available to upload. So, and we'll send it out to everyone who's registered. And without further ado, I will introduce our presenters from the North Carolina Medical Society External Affairs team. We have Thomas Kinchelow, and Thomas recently joined us in November and serves as our Director of Legislative Affairs. He is a University of Georgia graduate, go Dogs, where he earned his BA in political science, and he has spent the first 5.5 years of his career in DC as a staffer for Senator Richard Burr and Representative Dr. Greg Murphy. And then prior to joining the Medical Society, he served as the Government Affairs Associate for the American Academy of Orthopedic Surgeons. And then we also have Alan Skipper, who is the North Carolina Medical Society Vice President of External Affairs, engaging and overseeing the NCMS advocacy team and efforts at the state and federal level. Additionally, his responsibilities also include working with AMA and national specialty societies. Alan has spent more than half of his career at the NCMS as the Vice President of Specialty Society Management, where he served as the Executive Director for 10 state specialty societies providing management services. And I will not go into the very lengthy list of what all that includes. And Alan has been an integral part of the NCMS advocacy and specialty management efforts for over 40 years and is a proud Wolfpack alum. And I will turn it over to Thomas to kick us off.
Thanks, Kristen. Hey, everyone. Like Kristen said, Thomas Kinchelow. There we go. So here is my legislative update. So my update, folks, will be state focused and as far as what is going on currently at the legislature. So I will go over to the next slide. The legislature is already off to a very quick start. There have already been numerous bills introduced. As of Friday, there have already been 26 health-related bills that the Medical Society is tracking. There have been a few more since then, but that's the most accurate count that I have as of Friday the 17th. So yeah, like I said, already off to a very fast start. So what we're tracking. I'm sure everyone has heard the Medicaid Expansion bill has passed the House. There is a physician assistant team-based practice legislation that is making its way through the House. The House Rules Committee is hearing that today. When the Rules Committee hears something, that is usually the final step to a bill being on the floor of the House or the Senate. So we are expecting that today. We have not heard as of yet of any opposition to this bill, and the Medical Society in past years helped to write this framework for this bill. There's also a medical marijuana bill called the North Carolina Compassionate Care Act, which as of today cleared the House Judiciary Committee and is still moving through the committee process. This would allow certain patients with certain diseases to be able to get a prescription for medical marijuana. We're tracking that bill as well. There have been several bills to codify Roe v. Wade that we are also tracking, and then we are also tracking a Parents' Bill of Rights. Now, there's a caveat to this bill. Is this bill is mostly education focused, and we are only focusing on a very narrow part of the bill that has to do with written consent for minors, as far as going when they need to go to the doctor, and what consent from their parent or guardian looks like in that regard. And we are weighing in on that. So that's just some of what we're tracking. Now, here's some expected legislation. We fully expect within, we're not sure of the exact time frame, but probably pretty soon, there will be something on abortion. We are hearing right now that it will likely be a 13-week cutoff with certain exemptions after that in regards to the life of the mother. As you all, I'm sure, know, it is currently 20 weeks. And so we have a new policy on our website and related to reproductive health care. We are happy to share that if you've not seen it. But yeah, again, that is on our website. Also, we're expecting the Senate's version of a Medicaid expansion bill will likely look different than the House. We have not heard directly from the Senate yet, but we have heard rumblings that they could include legislation related to scope of practice, related to CON. Like I said, we are monitoring this and are looking to have some conversations in the coming weeks about what the Senate's version of this will look like. We also, there's also a chance that other legislation related to scope of practice could come up, whether it be related to optometry, whether it be related to genetic counseling, anything of that sort. We're always on the lookout for legislation that would expand scope of practice. And then other legislation will always come up related to healthcare. We're still very, very early into the session, and we are expecting all sorts of legislation to arise from all of this. I do also want to touch on prior authorization. We're hearing from our members constantly about how this is affecting their practice and how difficult this is for patients. If you all wouldn't mind providing some, we could do this later in the Q&A if you want to do that, or you can send them. I have my email address listed here. We would like specific examples from you all about how prior authorization is affecting your practice and your day-to-day workload. Again, that is a huge issue for our members who you all work with, and so we would love to hear from you all about that. And this is a big priority for the medical society going forward. So I'll go to the next slide. I did just want to touch briefly too on just legislative advocacy at the state level and what you can do. And so I just want to emphasize the importance of getting involved. You can call and write your representatives about issues of importance. And then one thing that I like to really push is peer-to-peer advocacy, which is educating your peers about the goings on in the legislature. Discuss issues with them. Be very professional about it, obviously, and don't get in anyone's face about this. But it's always good to have a healthy discussion, and you never know who you can educate and who will listen. But you as an individual can do so much at the legislature. I'm down there constantly. There are constantly folks coming in and having advocacy days. There's folks going on down there right now that are going to all the offices and dropping materials off, introducing themselves. So that's very, very important and something that anyone can get involved in.
Well, thanks everybody for joining today's webinar. And I know for the medical group managers on today's session, I know this is a precursor for your coming to Raleigh. I believe it's March 28, 29 for your day at the legislature. And there will be a lot that happens between now and then. So I would encourage you to stay in touch, stay tuned to the information that you're going to find that we send out daily, as well as that's available on our website, so that you can stay in touch. My part of the update is really focusing on some of the federal advocacy activities, and I think it's important that we stay tuned to what's going on in Washington. It's not that far away, and I think there's a perception that you really can't have much influence or impact up there. But there are some pretty important issues that I hope you're certainly aware of, if not engaging in. We still feel like the dust is still settling from the 2022 election. And last year, due to the census, we got one additional seat in the U.S. House. So we now have 14 members in the House, still obviously the 2 in the Senate. Of those 14, we have 5 new House members, and of the total, we have 7 and 7 on the Democrat-Republican split. And then in the Senate, 1 new member, Senator Ted Budd, who was in the House, but prevailed in his race for the Senate seat to succeed Senator Richard Burr. These are your House districts. Don't get used to them because they're probably going to change. That's one of the things that we're expecting, and I know Thomas is hearing more about that than I am right now, but the House or the legislature is anticipated to take up redistricting again. So all of that could change before the next election. And I think it's important that you know who your members of Congress are, especially since we've got several new members in the House. And running down these, this is the 1st through the 4th, and of special note, Dr. Greg Murphy represents the 3rd District. Dr. Murphy is a urologist in Greenville, and he is on one of the 2 primary committees of jurisdiction for us in the House. It's the Committee on Ways and Means, and he is also among the leadership in what we refer to as the Docs Caucus, and those are the physicians in Congress, and he is now in a leadership role there. So he, as well as things tend to move at a snail's pace in Washington, he has ascended up the ladder of involvement and leadership rather rapidly. So he continues to be somebody we obviously stay in touch with. Here's the 5th through the 8th. All of those are incumbents. Hopefully none of those names are new to you. The 9th through the 12th, particular note there, Congressman Richard Hudson is on the other primary committee of jurisdiction in the House. It's Energy and Commerce. He is also among the Republican caucus leadership, so he is increasingly influential in Congress. So somebody we tend to stay in touch with. I would also make special note of Representative Alma Adams. We work with her quite a bit on the maternal health front. She is a leader in Congress and is recognized as such, and we partnered with her on a number of things. You may have heard of the Momnibus bill that she has sponsored in the past, and we expect more to come on that front as well. These are the other 2 members that round out the congressional delegation. And to back up a little bit, while we focused on the primary committees of jurisdiction, we also have 2 members of the House who have become extremely influential. One, Representative Virginia Fox, who chairs the Committee on Education and Workforce, and also Representative Patrick McHenry, who is chair of the Financial Services Committee. It just represents, I guess, the potential influence our congressional delegation has in DC. So as you work with those folks, keep that in mind, because they can certainly have an effect on the outcome of our issues. And among those issues right now, I didn't mention, I did mention earlier Senator Budd, but here's them on the slide. Regarding Senator Ted Budd, he just recently got appointed to the Senate Health Committee. That is one of the 2 primary committees of jurisdiction in the Senate. And that is the committee that Senator Burr was co-chair of in his last term, and Senator Tillis is on the Finance Committee, which is another committee where we see many of our bills track. But back to those issues, top of the list right now is Medicare. I had the occasion to go to DC last week with the American Medical Association's National Advocacy Conference, and this was the primary issue that we addressed. They're in the period right now of bill filing primarily. There's not been any specific engagement on legislation, though the pile is getting taller as we speak, but we look forward to that. The other issues that we took to the Hill dealt primarily with workforce, with the shortage that we are facing now and the anticipation of it getting worse. We specifically addressed the need for more residency slots and also seeking some leniency on the restrictions on international medical graduates who train here, who must return to their country of origin before they can practice here. You may hear reference of the Conrad 30 restriction. That is the specific issue that we're seeking a waiver on in order that we can access their support and helping us with the access to care issue. We've got many areas in the state that obviously need that help. The burnout and administrative burden issue is one that is persistent, and Congress has actually given a lot more of attention to that. There's greater recognition as we're continuing to deal with, but hopefully coming out of the pandemic. So more to be addressed with them on that, and obviously the impact that it has on the workforce shortage. Particular to Medicare, that impacts pretty much across the board. And in the past, we have dealt with the cuts that have been that medicine has faced in reimbursement cuts. And at the end of every year, it seems like we're asking them to eliminate the cuts and sustain whatever the current reimbursement rate is. Last year, there were 8+% cuts on the table, and we were able to work it down to 2%, but nevertheless, it was still a cut. And in 2023, there are more to come. And over the past 20 years, physician reimbursement has declined 22% actually due to the inflation rate. So, you know, it's one of those situations, if you're sitting still, you're backing up. And recently, the Congressional Budget Office issued a report that talks about the cost of Medicare and Social Security is going to double by the year 2033. So there are some insolvency concerns that are there. We obviously are facing a contentious environment on the Hill. If you watch the recent State of the Union, that was probably one of the more memorable moments in some of the assertions and allegations made in a very verbal way about who was advocating for cutting or preserving Social Security and Medicare. And we're dealing with the party politics of it, as we always do. We're on one side, one of the proposals would be to raise taxes. And on the other side, one of the proposals would be to increase the age of eligibility. So we try to interject ourselves into the discussion to try to move the needle on this, and we will continue to. Last week, our ask of both the House and the Senate was that they need to hold hearings in order to get this process started. And one of the specific asks in that is that we need a specific adjustment for physicians added to the formula. Other Medicare providers have that already built in. Physicians do not. We know it's going to be a multi-year effort, and we need to keep the pressure on. So we're going to have some sustained engagement. And just like Thomas asked earlier about examples of how prior auth is impacting your practice, and we're asking also if there are examples where Medicare reimbursement has had an impact on your practice, and whether it's practice viability or patient access to care, those would be helpful as well. Beyond what's going on in Congress, on the administrative level up there, there are two issues that I know you're very familiar with and that are pending, one being prior auth and the other surprise billing. On the prior auth front, last year there was a bill that actually gained bipartisan support. It was HR 3173. It did not pass, but it did gain a lot of attention and support from both sides of the aisle and in both chambers. But back in September, CMS actually announced a proposed rule that would address prior auth within Medicare Advantage, and it actually is broader than what the legislative proposal was. So it has some promise. Some of the features are the mandatory adoption of electronic prior auth, required decisions within 72 hours for urgent requests and 7 days for others, and a requirement of that prior auth metrics be published. So there's that transparency piece that we keep hammering on. And in response to that announcement from CMS, the AMA drafted a sign-on letter, which the North Carolina Medical Society joined along with other state medical societies. If you're interested in that, I'd be more than happy to share a copy of that so that you are aware. The implementation of the rule is not until January of 2026. So we've got a time lapse there that is going to add further pressure. So I wouldn't be surprised if Congress takes this back up again because of that gap. But again, we will have to continue to put pressure on that and see what CMS does. On the surprise billing front, that law was enacted in the No Surprises Act back in December of 2020. It was referred to the three departments of HHS, Labor, and the Treasury. And what ultimately came out of that was a rule that was initiated, but not necessarily consistent with what the law said. And ultimately, following that was I think there's a total of 4 lawsuits have been filed. Texas Medical Association has taken the lead on that. We have been supportive of the effort and continue to work to try to be a constructive participant in the discussion to keep refining what the rule that was issued. In the first 9 months, some of the numbers that have come out of that, the Blue Cross Blue Shield Association has reported that 9 million surprise bills have been averted due to the law and the new rule. It is a measure of its success, but it has not been implemented in a manner that has been what we would consider fair to those who are filing for consideration in the disputes. And in recognition of that, the House Ways and Means actually last November issued a letter to CMS telling them to take it back up and to fix it. And you may have heard earlier this month, the first week of February, one of the lawsuits that the Texas Medical Association filed at the federal court ruled in their favor, which in that lawsuit was challenging the independent dispute resolution process, whereby those disputes could be arbitrated. And as a result of that ruling, CMS has suspended arbitration for now. So we're in a wait and see period again with that, somewhat like the prior auth as far as what might evolve out of that. So that's the congressional side and I guess the administration side. And to wrap up, and this touches back on where Thomas was encouraging you to get involved. Your influence and involvement is vital to our success, which is obviously your success. So you need to know at the state and federal level who your House and Senate members are. It's more important that they know who you are. So we would encourage you to be a key contact for those individuals, and we would welcome your participation. And you can let me know. My email address is on the last slide. You can email me if you would be willing to engage on some of the issues, especially what Thomas referenced as the prior auth legislation that's coming up, because those of you who are practice managers see it and feel it every day, as our members do, our physician and PA members. And please encourage those in your practice to get involved as well. We need support across the state, and we need for you to find out who your legislators are. If you go to, there's the legislature's website, ncleg.gov. If you go to that homepage, you look up on the top right and click on Find Your Legislator, type in your home address, and that will give you that information. If you have difficulty finding it, let us know. Thomas and I will be more than happy to guide you, and we will also be happy to help make that connection with them so that you can connect where you are. You don't have to come to Raleigh to meet with them. You can do it, and that sometimes even more effectively when you're back home. So with that, I'll also share my thanks. We appreciate our partnership with Medical Group Managers Association, both at the state and national level. We encourage you to stay in touch with them at the national level as well, and appreciate your support. And with that, Kristen, I will kick it back to you or to Thomas, and just let me know if there are any questions.
All right, thank you. All right. I haven't seen a whole lot of questions. I do see in the chat. Melissa, are you talking about the political pulse videos? With your question about the electronic briefings on Fridays? If that's what you're referring to, the political pulse video started what, 2 weeks ago, I think, 3 weeks ago. So we should have a couple of those we have a couple of those that we have already pushed out, and I can find the YouTube link and include that in follow up and try to find it to put in the chat here in a second. So thank you for bringing that up. Any specific questions? And at this point, you can just come on and unmute yourself and ask your questions if you have any.
This is Susan Childs. Can you hear me?
We can. Hi, Susan.
Hello. Prior authorizations have just been getting worse and worse and worse every day. You know, every time you need chemo, the whole thing. I'm wondering what's the best thing we can say to legislators about the everyday stuff that practices have to go through, that we can make a difference, that could help.
Sure, Susan. Thank you for that question. If Alan has anything once I'm done, I would welcome his comments too. I would say that what you can tell your legislators is what's going on in your practices, how hard it has become for your doctors to treat patients, how hard patient access has become because of prior authorization. Again, if y'all can provide specific examples to Alan and I, that would be amazing. Oh, I didn't realize Dr. Rita was in this chat. He just commented as well. If we can set anything up for you with him, we're happy to do that as well. But yeah, any specific examples y'all can provide to us would be greatly appreciated.
Yeah. Yeah, I agree. You know, we've engaged on prior auth kind of on two levels, but they certainly interrelate. One is on the administrative burden to the practice, which conveys to cost. So the cost of the additional FTE or multiple FTEs that have impacted your practice, that's important. It quantifies that issue. And the other is just the impact on patient care, on outcomes, on delays, anything like that that helps us paint a clearer picture, adds weight to our message. So both are very helpful, and you can share them individually if you meet with your legislator. But if you send them to us, that will actually add to our catalog of what we're keeping up and helps us as well.
Thank you, Alan. You know, what I'm looking at is every day in there, and I know you can't do anything about the payer's procedures, but when a patient goes in for chemo and they don't know if the next one's going to be approved, that's a process from the insurance company that's gone through in the recent years. We won't get into why, but you know, how do we attack that? How do we look at that in their general processes?
Are you referring to like the lack of uniformity of the prior auth process on their end?
That's a huge part of it. Yes.
Yeah. Yeah. I mean, right now we are working on a proposal to take to the legislature. And I think we've kind of referred to that under the term of transparency because it exposes that. So that would be one element of something we would be looking to include in any proposal that we put forth. I know on the federal side that also has been one of those issues. So in overall, in that regard, we would look for consistency, but mostly for effectiveness.
Oh, thank you.
And just very quickly, Susan, the more of these things that y'all can put in writing and send to us, the better. So when we're communicating with legislators, we can talk about these examples.
Okay, thank you.
Hey, Melissa White here. I just have one question that's not on prior auths, but I was recently at the North Carolina Hospital Association meeting and looking at our listserv from NCMGMA and listening to providers at that meeting, plus our members. There's increasing dissatisfaction with our current privatization of Medicaid in North Carolina, and lots of people not getting paid, especially on some standard things that they used to get paid for. And just kind of wondering, since we're anticipating coming down there and talking to our legislators, how are we doing with that? I mean, do they have to, at one of our conferences, we had representatives from all of those companies there to talk about what they intended to do to standardize everything and to make sure that Medicaid was smooth as it could possibly be. And now we're into this for a couple of years, right? And we're kind of seeing a lot of trouble with that from just various things. Patients us not getting paid because not being able to verify if someone has a particular plan or they're out of network. Or for us in primary care, it's a simple fact of a baby's born in the hospital and we take care of them, and then mom doesn't get attributed to the right provider, and then we don't get paid because we're out of network with that provider. Anyway, just thinking about going to the tailored plans that's starting in April, and then future plans of how to manage public health. What do you know, or do y'all have that on your radar to kind of check in with those people and see, hey, how actually are we doing? And is the state making money doing it this way? Or are we crashing and burning? Where are we with that? I guess would be the best question.
Hey, Melissa, I know that this was one of the questions that you had brought up when we had spoken before, and is something that we will have to look into a little bit more, just to understand where we can get the most accurate information with that, specifically about kind of the, I guess, financial sustainability thus far with Medicaid expansion. Because I know DHHS usually does I don't know if it's a quarterly report. And Alan, you may know better than I do on that, but I know that they do an update, and I expect that will be sometime in the near future. I don't think there's been anything scheduled that I'm aware of yet. So I am looking out for that. And I have sent some communications out to DHB just to get some more information. So once I have that, I can share that.
Thanks, Kristen. I was just trying to think about all the, when you start seeing language on the listservs about people thinking about not taking Medicaid anymore, simply because of the administrative burden that it causes and just not getting paid. I mean, you still, and I know it hits some practices harder than others, the pediatric groups and some of the hospital clinics and things like that don't have a choice. It's really a big thing. But I mean, I personally am paying somebody to chase money all day long just for that particular payer. And that's kind of ridiculous. I mean, we don't live in that age anymore, and you should be able, if the rules are the rules, you should be able to, streamline some of this. So not trying to monopolize this. I just think that in our advocacy days, we would love for Dr. Rita to be able to come to that, or to any of you guys to come to that and listen to some of these concerns. Well, and I've encouraged our members to go ahead and make appointments for while we're down there also. And I already have a couple myself, and, trying to go as a group to see, and we hope to work with you guys on getting bullet points to be able to to be able to be a little more efficient of the legislature's time too while we're there. So, but yeah, looking forward to that. And I appreciate your help. And I just think that the membership, our particular group, that's one of our pillars of our organization, and we're just trying to step it up a little bit. And it seems like that's just perfect timing with all the things that are on the docket. So thank you.
Thank you.
Thomas mentioned Dr. Rita Weir on the call, and we never want to miss the opportunity to extend a big thank you to him. As I think probably everybody knows on this call, Dr. Rita was elected to the North Carolina House back in November. He's in his first term. And then also Dr. Kristen Baker, physician from over in Concord and Catawba County, is now in her second term. So, and Dr. Rita knows this, when as a physician in the legislature, we lean on him, but we always tell him that he can lean on us, because there's a lot of issues like what Melissa, like what you just brought up, and Susan, you as well. Those are the things that he's going to be hearing. So we want to be a support network for him as these things begin to get more discussion. So Dr. Rita, thanks for being on, and thanks for being there.
Thanks, Alan. Happy to be here and just to listen, and stories are really helpful. What I've come to understand in a short time is data sometimes matter, but stories are really powerful.
Hi, I'm one of the physician advisors that works with ECU Health and in Dr. Reader's side of the woods, but I'm attending this meeting for the first time, and I'm finding everything very interesting. But I wanted to point out we are looking at ECU Health, the prior auth discrepancy for Medicare determined inpatient-only surgical procedures, and the financial impact of those, because certain insurances want a concurrent prior auth even for inpatient-only procedures, and that is not followed like universally by most insurances, and certain insurances have their own rules and stuff based on which they deny pay for these procedures. And we are at this point doing some pilot projects at certain surgical interventions. I'm particularly involved with the Watchman procedure, which has, deemed inpatient only by Medicare, but it does have a lot of pay discrepancy if, so we are chasing this prior auth document, and right now we are doing this pilot project and all that. I thought I'd just bring that up as an example of surgical procedures and prior auths and how they impact us.
That's very helpful. And I'd be glad to connect with you and with Dr. Murphy, because I know he is very sensitive to what's going on, certainly in his district, but certainly in Greenville and at ECU. So this would give him great information to take back with him as they continue to work on this issue.
Sure, that sounds good.
And I did see Deborah had asked if there had been any discussions or initiatives regarding practices paying fees for electronic healthcare payments. I have not heard anything thus far about that specifically. Are you hearing anything specific, Deborah, with that? Or you guys?
I'm not aware of that either, Kristen.
Not.
Are you talking about from the payers requiring fees to get payments? I don't know if Deborah's still on.
Hey, is she talking about the credit card fees? Because if you take a ACH transfer, or if you take a credit card fee, which some of them like to pay you, there's a fee associated. That might be, I'm not sure if that's what she's talking about, but that is one of the places where there are fees.
Yes. we continue to see payers solicit, and sometimes it's very stealthily the way they try to get into our electronic, payment system, or from the back end when our staff are posting those payments. We're already discounting the United Healthcares of the world, or they're discounting us on payments, and then it's almost like I think a 1% or 0.5%, sometimes 2% deeper discount because they're payer vendors taking that from us. It just doesn't, and maybe that's something we need to negotiate through our contracts, get a higher rate, because if we want to accept those electronically, we try to avoid it. We're small enough where we can post those payments manually, but it does create a burden to do it manually. You have to see the benefit versus cost. Is it cheaper to pay staff to do it, which right now it is for us because we're not quite big enough to where we're getting thousands and thousands each month that we can't post manually.
Is that something that is a part of the contract as well? I don't know if you can talk about that, but is it in the contract, or is it something that's separate from that they just added on?
I believe
it's separate. Excuse me, go ahead.
No, go ahead.
I was going to say it's separate. It started out 3 or 4 years ago. It was a surprise. We'd accept the Zealous, and boom, we were getting, deeper discounts than when we do our payment analysis than what we expected, and, figured out we had accepted the ACH or, whatever kind of payment that they were charging us for. It's ongoing. I think it's something we'll probably look at when we renegotiate contracts, because we're getting to a point where we really do need to be posting some of these payers' payments electronically. One is a very large payer, MedCost, for our region here in Eastern North Carolina. It's just been a source of contention. I thought that it was brought up. Maybe the CMS said they couldn't force us to take those payments. There may be some management of it from the government payers, but not so for our commercials.
Yeah, now that you mentioned that, I've definitely heard bits and pieces, but I wasn't sure how impactful this was and how deep it was hitting the and if it was across payers, because I've heard tidbits here and there, but that's about it. So I didn't realize that it was quite as widespread as it seems that it may be.
It's all over, and it's everywhere. It's all over. It's with every payer that can do it. And it's a private thing too. So I know just enough about this to be dangerous. So do not take my advice. My advice to you would be to put this on the listserv again, because there are people that have dealt with this with private payers, and they know exactly the steps to do. It's somewhere in how you receive the payment. I'm not sure. It's not in your contract, I don't think. And I don't think the payers are going to give you extra money just because you have to take it electronically. That's not something that they consider important, even though it's a cost to you. So I would put that on the listserv again and ask, because people have gone through this, but I don't remember the exact steps.
Okay, thank you. And I did get a question about the state health plan, which I know has come up from numerous people over the last couple of weeks. And that's something that the Medical Society and the medical group managers have been talking about and are working on just to look into and get a little bit more information. I don't have any specific updates at this point that hasn't already been put out publicly. But if there are any specific questions or concerns that you all have or hearing, please feel free to email me with that, so that once we do meet with them, we can share some of that with them. Any other questions or thoughts?
I put one in on the Medicaid expansion. It's about the third question down. And the question is when the Senate tries to load that bill up with extraneous stuff like the SAVE Act or the business about, prior authorization for things like radiology centers, all that sort of thing, certificate of need, I believe. The Senate tries to do that. What is our position, in my opinion, should be totally to not like that. But what are we going to do to try to stop the Senate from doing stuff like that? Because they certainly did last term.
So we are meeting with members. I will tell you that the Medical Society on CON is neutral, but we are ardently opposed to the SAVE Act. And we are doing some doing some outreach with some folks just to discuss that issue. But we're trying to have some conversations with the Senate too, just to express our position. But we don't know yet what the full extent of what their bill will look like. But we are sort of trying, we are trying to make our position on Medicaid expansion known.
And this is a great example of an issue where you can and probably should get engaged. Don't wait for the Senate to do something before you reach out and let them know your concerns. We are very supportive of the clean bill, as we refer to it, that Dr. Rita and the House passed. So that's where we are right now. We are certainly cautious in how we're engaging simply because of what we experienced, as you brought up about what happened with the Senate last year and the things that they attached to expansion. There's also the prospect of Medicaid expansion getting rolled into the budget this session. So that adds another dimension of the debate and how we can address it as a single issue. So to some degree, we're in a little bit of a wait and see, but as we are in those periods, that's where it becomes increasingly important for our members and the Medical Group Managers Association members to reach out to their members of both the House and Senate on this.
Excuse me for just a second. Is that somewhere on your site in the things that you're for and things you're against? So we could direct our members to the clean bill or whatever, so we could sort of put that. I know everybody's going to have their own opinion about that, but for those of us that have physician offices, there's a couple things that we don't want tacked onto that bill that they tried to push through last year. And it is good for me to contact my own representatives, but it would be nice to be able to shoot that out across our listserv for those who want to really hone in on that, like you say, before that becomes an issue.
You're talking about like the action alert?
Yes, is that where it is?
I don't know that we have one on there specific to this at the moment.
Or do you have something we could have that, that we could sort of steer our members that if they're in favor of that, this would be the language they would use to talk to their representatives about?
Yes, I think we could figure something out with that, and I'll follow back up with you, and then we can put it on the listserv once we have something.
Perfect. Thank you.
I think for the Senate contact, it's really about trying to do a clean bill, and especially don't load up scope of practice and the SAVE Act to it. That's probably the more onerous of the two. I think CON is, we could probably manage something, but the scope is a bigger issue.
And I'm assuming, just one more thing, I'm assuming that y'all are going to let us know when we need to enlist our membership in the letter writing or the, when some of this gets to the very moment, how you guys have done that in the past. That's been very helpful for our membership, to be able to direct them when it gets time for voting. I hope you'll continue that. I'm just saying.
Yeah, that's easy to do. Anytime we send out any alerts of especially an urgent one, we can easily share that. and appreciate your in turn sharing it with your folks.
Well, thank you all. If there's any additional questions or concerns that you would like to bring up before we call it. All right. Well, thank you all for joining us very much. And as I mentioned, this was recorded, so I will, once we have that ready to be shared, I will send it out to everyone who is registered, as well as to our respective organizations to push out. And any additional questions or suggestions